Welcome back to the Build Initiative's Home-Based Childcare webinar series. Today, we're going to be discussing using federal relief funds to support home-based childcare. As you enter, we're going to just take a quick poll to see what you're thinking about the new federal relief funds. And as that's going, we'll go ahead and take a review of the agenda for today. We'll let that poll go for a little bit. So on today's session, we are going to welcome everyone back. We're going to touch base and on our core beliefs that are the basis for our series of webinars. Then we're going to get into the meat of it with Natalie Renew from HomeGrown and Christine Johnson-Staub from CLASP. And then we're going to discuss what's coming up next. As on all the other sessions that we've had, we want to take a minute to define how we're using the term home-based childcare. We are using it as a term that encompasses all the places children are cared for in home-like settings. So this may be licensed exempt, family, friend, and neighbor, family childcare, registered. States have many different names. We're going to go ahead and share the results. Seems that many of you, your state has started discussions of how to use and support the funds. So today's conversation is really going to help you advocate for home-based childcare and know what's possible. On all of our sessions, we like to take a minute to connect before we get started. And today on registration, we asked that you share what you would like to see, what changes you would most like to see to make your home-based childcare system more equitable. And many of you had wonderful ideas, and we'd like to invite you now to come off mute or come on video and share some of the ideas that you shared with us.
Danielle, I'll jump in while folks are thinking and finding their mute button. Hi, everyone. This is Gina Capito, consultant with Danielle and Jessica Arguez-Duggan with the Build Initiative. We're happy to see everyone again for this deep dive into the relief funds for family childcare. And that makes me think, as far as a let's connect or reflecting, I hope that this is a way to make the system more equitable, but I would really like for family childcare voices to be the leaders on how the system responds to their needs, instead of our system being built thinking about childcare writ large and sort of assuming that some of the concepts will apply to family childcare as well as centers or school-based settings. And the reality is, we know that there's such a disconnect, that it's such a different modality of care, and that's what makes the modality of care so robust, and why families select it is because of the nature of what it is to deliver care in your home to your own children and other people's children. And so what I would really like to see to make the system more equitable is that the voices of the individuals that are providers, the leaders in family childcare, are really the drivers on what the systemic components look like for family childcare. So it sounds a little bit circuitous, but hopefully you're all following me as you're all leaders in family childcare.
Thanks so much, Gina, for getting us started. It was in line with some of what people shared at registration. I'd love to hear what else, if that resonates, or what else you're thinking.
This is Antoinette Elliott. I'm a home provider in Georgia. And if we could just have access to capital, a lot of times they want to say, okay, we're going to give everyone a grace to the air conditioning system for cleaning, or we want everyone to have this. Well, some people don't need that, and we know what we need individually. So if we just had access to capital, we could do what we need individually and turn in the receipts after the fact. We don't need someone to suggest what we need to do or provide us X that we have to do. Maybe we want to add on to our home so that the center is a little bit bigger, so that it's more comfortable to accommodate 4 or 5 different age groups. Nobody says anything, they want us to have every age group, and it doesn't matter if the child has a special need or not that requires more space or more time, and they just expect us to use it in one spot and make it work. Well, sometimes we need more space to accommodate. We don't have access to capital because our taxes don't give us access. We can make money, but when you go to try to apply for money, they're looking at you. They'll take your net profit. Once they divide it out, they don't see how you can afford anything else.
Antoinette, that's such an important point about capital, because when we have capital conversations, it's really about bricks and mortar centers and schools, or our capital discussion. So thank you for raising that up. That's such, I even personally feel like I've had a blind spot to that over the course of doing systems work and haven't really thought about the capital needs of family childcare. They're often thought of as like grants for fences and things like that, but not really some of the deep capital needs.
Jeannie, that's the same thing that I've discovered in Arkansas when I talk to people. You know, I can make assumptions about what I think they need, but they actually know what they need in their homes. And so if they, you know, give them a dollar amount and a list and let them get the things that they need instead of someone else deciding what those things are. And I think that would also make them feel validated. It would also make them feel in control of their business instead of someone else controlling what they can and can't do within their business.
Thank you so much. Tamara, you have your hand up. Feel free to unmute or come on camera.
I'm a little concerned when they say that money will be invested in family child care. With that always comes some type of a stipulation or a regulation that really doesn't pertain to us. Many of the things that come down are more center based, but they just put it across the board with monies. And Antoinette was exactly right. We don't have the access to that capital. We don't have advocates working for us that will help us speak for ourselves. Thank God, I guess in a way, that's one thing that has come out of the pandemic is that we have started speaking for ourselves and talking about the needs that we have. Thankfully, I was able to stay open, but I know so many people who had to close and they will never, ever, ever recover economically from last year. So that was my comment and my thought as well.
We have in the chat box too, the wish to see more or better payments, maybe the opportunity to have more kids depending on space, and something that Antoinette mentioned as well, the opportunity for more space. With that, I'm going to go ahead and turn it over to Jessica, who's going to review with us the core beliefs for this week's session.
Thank you, Danielle. Good afternoon, everyone. It's so nice to be here with all of you. As Gina mentioned, I'm Jessica Rodriguez-Duggan, and I am one of the wonderful team, as part of this team that provides the work here for the home-based childcare. As we know, all of our national webinars and all of the work that we do around home-based childcare, we know that our work is grounded. The core beliefs that we have identified as part of this work are grounded in every piece of the work we do, as we think through and look at what we are discussing and what we are outlining in goals and how we approach our work. They are grounded in the 4 core beliefs that drive this work forward. For today's discussion, as we're continuing to discuss the federal fund dollars and what that means for home-based childcare and the opportunities and the what the landscape could look like, we're going to be concentrating on 2 core beliefs. The first core belief is our core belief number 2, and the strategies and the system components that support home-based childcare settings, how they should be resourced on par with center and school-based settings, which speaks to the conversation that was just had a couple minutes ago. The idea of access to capital, ensuring that providers and leaders drive the work and have opportunities for input and make those decisions for those resources that oftentimes center and school-based settings. And then our second core belief that our work is grounded in today is the core belief number 4, that family childcare needs to be approached in a systemic way across all of the various federal initiatives and then funding opportunities. So a perfect setting for the conversation that we are about to have. And as Gina mentioned, you know, when we're thinking systemically to ensure that we are looking at funding across all the needs that family childcare providers have. So with that, I am going to pass it on. We are lucky to be joined today again by Christine Johnson-Staub, who is a senior policy analyst at CLASP, and she will continue our discussion on supporting home-based childcare with federal relief funds.
Before Christine jumps in, and Christine, I wanted to share, just to reflect back quickly on the poll that everyone did, because I think that it's really informative for Christine and Natalie both to think a little bit about where our audience is around their opportunity to participate in thinking about how relief funds would be used, or what the plans that would be written for how those relief funds get used. So, and if we look at the poll, we see that 30% of the audience is reflecting that it's unknown. They're unknown in their understanding of whether or not there's how their state or community is deciding to use the new funds, and that. But 57% do know that there's discussions have been started. So I think being thoughtful about how you're involved in those discussions, what role you may be able to have even once the funds start to flow, and informing how they, what providers are allowed to use them for. All of those decisions that states sort of get to make underneath this will be really helpful. And I know that both Christine and Natalie can reflect a little bit on that as they unpack some of the nuts and bolts of the dollars as well. So I just wanted to raise that up. So now the floor is yours, Christine.
Okay, thanks. So thank you, Jessica, and thank you, Danielle and Gina and everyone for having me on the call today. I've really enjoyed the conversation so far, and I just want to say I just truly appreciate people making time in their day to get this information and to think about how to use it, because I know you've already got so much on your plates, not just because of the pandemic, but always. And so I hope that this information will be helpful to you in engaging with the use of these dollars, and also helpful to you giving guidance to states about how they can best help you do your work. That's so important. So I'm going to start by giving kind of a broadish overview of what's in the American Rescue Plan in terms of the chunks of dollars that are in there, and then we're going to really dive into the guidance that came out last week, which is specifically about the stabilization grants. So I'll get more into that. I think when you talk about capital for providers, that is really where the opportunity is in those stabilization grants. So, so I want to talk about how they can be used, what some of the parameters are, and what decisions your states are making about those. So just to start out, when the American Rescue Plan passed, it included 3 pots of child care funds. It included a lot of other money too, which people are making decisions about, that are going directly to communities, that are going directly to states for really flexible uses, that are going to Head Start. That there's a lot of funds going out to K-12. So there's a lot of other folks who are getting funds from this act, but I'm going to talk just about the child care focused ones. So these 3 pots are slightly different, and it's helpful to think of them as there are 2 pots of CCDBG supplemental money, and that is really about supporting individual children and families and getting access to childcare. Just, state subsidy systems use this money to help families pay for childcare, and that's really how these dollars are designed. They can be used in other ways too, and we'll talk about that. But that's really about, for the most part, that's really about the child and the family. The sustainability grants, which is $24 billion, so really the biggest chunk in the American Rescue Plan is in sustainability grants, are dollars that will go to the state, and then the state will re-grant them out to you, to providers, and in different ways. And they have, again, a lot of flexibility in how they do that. But it's really designed to help relieve some of the costs you've already had related to the pandemic, help pay for things that you may need going forward to recover, and really about supporting providers, and so that they can better meet the needs of families. So I think it's helpful to think about those 2 tracks, because I think there's a lot of questions about how the dollars can be used. And for the most part, if you're talking about additional spaces for kids, additional slots, additional subsidies, changes in eligibility for subsidy, like those are much more easy to address with the CCDBG dollars that are very flexible. And there's a lot of those as well. And then when you're talking about ways to really fully support providers, and not just providers who are in the subsidy system, but all providers, then the stabilization grants are much easier to use that way. So I'll get into that a little bit with each pot. So this graphic just shows you a timeline. It's, sorry, the spacing's a little off, but basically what it shows you, the slide before that, yep. Shows you the timeline for each of these different pots of money and specific, and for all of the assistance that's come out, all the federal assistance that's come to the child care system over the course of the pandemic. So we remember there was the CARES Act that put a bunch of money out. Then there was the coronavirus relief funds that came out in January. And now there's the American Rescue Plan stabilization funds and the American Rescue Plan CCDBG funds or subsidy funds. And basically what this is designed to show is that these funds cumulatively are designed to be spent from 2020 all the way out to 2024. And so states right now are getting these different pots of money, and they're trying to figure out, based on hopefully input from stakeholders, what are the needs, who's been left out, how do we target the funds, and they all have slightly different uses. So they're trying to figure out how to best use the pots of money that they're getting to support the field in their states, and given the timelines that they're allowed to spend it. So there are some purposes that really serve themselves to a longer time frame, and maybe they want to use the CCDBG money for those. The stabilization grants are kind of all within the course of 2 years, and the timeline around them is that they have to be obligated, which means the state has to know who's going to get them by the end of September of 2022. So a year and a half, a little less than a year and a half from now. And then they have an additional year after that to spend them. That's a pretty quick timeline as far as state spending federal money goes. And they have to make decisions well ahead of that. So the first decision point is that they'll have to include a description of what their grant program looks like in their state plan, which is due in July 1st. And then in December, they'll have to say if they don't think that they're going to be able to obligate or spend half of their stabilization grants by December, they have to let the Administration for Children and Families know that. And then in April, if they know they're not going to be able to spend all their money by the end of September 2022, they have to let the Administration for Children and Families know that. And at that point, some of those dollars will get redistributed. So there's there's a timeline built into the guidance and into the law that is designed to really get the states to get this money out the door quickly, by government standards.
Christine,
yes.
Would it be appropriate to speak to some of those, like breaking down the nitty gritty there a little bit? There's a question from Angela Duran around how long then the grantees that receive the funds have to spend them.
I think it depends on how the grants are designed. I haven't seen language that really specifies that. I think the money has to get out to the providers by the end of fiscal year 23. So by the end of September 23. But if they're, I think once the money is out to the providers, that's considered liquidated. So I think it depends on what the grants are designed to do and how states design their own specifications around that. And yeah, I have a hard time talking and following the chat. So if people want to just jump in with questions from the chat, I'm happy to answer them as we go along. Or if anybody wants to unmute and ask a question, that's great too.
There was one other one, and I apologize because it's possible that you may get to this, and I know this one has come up a lot, and we also heard this in several of the registrations asked similar questions around this, around whether or not the federal legislation requires states to use the funds only for licensed providers, or can it be used for ones that are not?
Yeah, I am going to talk about that, and it was actually one of the first things I wanted to talk about on this slide. So, so this slide is specifically about the stabilization grants and what the law says about them and what the guidance that came out last week. So I talked a little bit about the timeline. Guidance came out last week and told states more about how they can use the funds. I think just generally speaking, I want to kind of describe how they can be used and what the opportunities for family childcare are, and then I'll get into some of the nitty gritty from the guidance. So the stabilization grants include an ability for states to use up to 10% of their dollars for administrative purposes. And the language of the law really emphasizes designing grant programs that are accessible to providers, helping providers connect with those grants, making sure they know about them, doing the outreach, doing the technical assistance around applying. So all of those things that help providers get access to the grants are built into that administrative money. In addition, they can use it for data and technology improvements that help to distribute the grants and help to collect data. And they can use it for things like supply building, which specifically for family childcare, the guidance names staffed family childcare networks as one of the allowable uses for supply building. It can include incentives for non-traditional hours, infant and toddler capacity. They can do analysis of underserved geographic areas or other types of needs. And so they can use some of the administrative dollars to help with startup costs, to help with, application processes, licensing, whatever it is that may be a barrier to creating more childcare. So that supply building piece is built into the administrative part. And then they also, like I said, really emphasize the outreach and technical assistance part of the administrative costs. So that's just 10% out of $24.9 billion. The rest of it really has to go directly to providers and in the form of grants. And the grants can be designed so that they're monthly grants for 6 months or that they're one-time grants. The states have a lot of options in how they design them. And they can also design multiple grant programs that they can either have separate application processes for, or they can combine under one application. So they could do a grant program designed specifically to help with some of the facility costs that were being talked about earlier, about helping to make improvements to space, to buy equipment or things like that. Or they can be just general grants that give you all of the choices about how to use the money that's coming your way. Or they can be grants that are designed specifically to help with compensation and benefits. Or for, so a lot of centers are talking about recruitment and retention. They can be grants that are designed for those expenses. They have to be based on provider expenses, but the guidance really emphasizes and gives some strategies for states to estimate what those expenses are. They really want states to not create a lot of paperwork for providers because that's a barrier to providers accessing. So they do say that states can do things like cost estimations. They can do surveys to providers to see what their costs look like. And each provider will have to say, yeah, this reflects my costs, but they won't have to provide a ton of documentation to apply for the individual grants. So that's good news. And they can also use tax forms, so I think sometimes for home-based providers, the easiest way of assessing expenses is tax forms around your expenses related to your business. So there's a lot of strategies there. Yeah, go ahead, Danielle.
That brings up an interesting question in terms of the tax documentation and things of that nature. Is there anything in the regulations that says that it only can be used for providers that are legally US citizens, or what does that look like?
It does not say that. And again, states are designing their own grant programs and their own documentation. So, we're exploring that question a lot at CLASP because that's a really important part of our work. And we think that, that if a state says, for instance, that a provider can have an ITIN instead of a social security number, that's sufficient for applying. But it doesn't have a lot of specific language in the guidance around immigration status. It's a great question though. And we are, like I said, we're continuing to look into it because it's really important. So the grants broadly in the legislative language say that they can be used, I've covered some of these: personnel costs, facilities, supplies, equipment updates, goods and services, mental health supports for children, and for educators or providers. Those are the kind of things that were in the legislation. But they don't have to be used for all of those things. And like I said, states can design multiple grants to target certain expenses or to make grants available to certain providers in certain communities or for certain types who are providing certain types of care. So if they want to incentivize non-traditional hour childcare, they can do a grant program that is, specifically for providers who are willing to offer non-traditional hours. I think I've covered everything on the slide, but what I did want to get into is who's eligible, because it's really kind of confusing. It is confusing in the law, and the guidance is only slightly clearer. And I've heard now Katie Ham from ACF talk about this piece, and I'm still a little confused, but I'm going to tell you what I think she said. And what I think she said is that there are basically two paths for being an eligible provider for these funds. The first path is that you were a provider who existed when the law passed, and you are part of the subsidy system or not. You don't have to be part of the subsidy system, but you meet all of the requirements of your state subsidy system, in which case you're an eligible provider. That's true for some family friend and neighbor, for some license exempt programs. If the state has registered you or regulated you in any way, then you fit that category. If you don't fit that category, but you do fit the broader definition of eligible providers in the Child Care and Development Block Grant Law, which is very broad and includes relative caregivers, then you can still be eligible for the grants, but you may need to meet some additional state requirements in order to move into that other category. And you don't have to have met them by the date of the law passed, but you will probably have to meet them before you're eligible for the grant. So this is going to be something that I think states are going to have to really communicate about clearly. And if you are already engaged with your state in any way, you're probably fine and you're probably eligible. The one other caveat around family, friend, and neighbor caregivers is that in the case of relative caregivers, they are eligible for these grants, but they have to be providing care to a child who is CCDF eligible, so who's eligible for subsidy, which means low income and meeting other requirements of eligibility. So I know that's a lot, and I don't know, I think there's going to be more questions to come around that. But the bottom line is that if a family, friend, and neighbor provider is not registered or licensed, is not meeting state requirements for subsidy programs as of March 11th, they can still access the grants, but they're going to have to meet those standards first. And the relative caregivers can be eligible for grants as long as the children they're caring for are eligible for subsidy.
So Christine, that's exactly one of the questions that was asked. And I think that I'm just going to put a finer point on it, because I think that the question itself from Joe, and Joe, you're welcome to come off mute too and add more detail, but that question of whether is it to homes that were open before March 11th or ones that opened after, it's really not that clear cut, because you can open after March 11th. It's about meeting the other requirements around serving CCDF and being involved in the state system.
Yeah, that's right. So we thought that all providers who were going to be eligible were going to have been open as of March 11th, but then this guidance really clarified that there's another path, and that I think is great, and it's going to be really helpful both to states and to providers. So yeah, if there's additional questions about that.
Right, there's one more, so I'm just going to tag it on. Judy Graca just put it in the chat, is that it's about eligibility of relative providers. And I think one of the biggest things for the relative providers is that point about serving a child who's eligible for childcare subsidy funds or CCDF funds. I think that's one. So there may be other instances, but that's one of the most important pieces for when you think about relative care.
Yeah, I think that's right.
This is Joe. Can I add the second element to my question? There's language in there about supply building. In one place, it says it can't be used to help new programs get started. But then it turns around and says, you want to help programs do infant toddler care, serve children with special needs, all these other categories as being supply building. So I'm confused about whether supply building allows you to help new programs get started, or can only spend the money on existing eligible programs.
So out of their 10% set aside for these grants, the administrative dollars, they can do supply building activities to help new programs get started. So they can help programs go through the process of getting registered or licensed or whatever they need to do. They can help with startup costs. They can use those administrative dollars for new programs. The grants are designed to give relief to existing programs. So they're not to open new programs. But they can also be designed, to your point about infant, toddler, and other incentives. The grants can be designed to incentivize types of care, so they can pay higher rates, they can be based on estimated costs of paying higher rates for infants and toddlers or something like that. They can be designed to incentivize, which is different than starting a new program, right? So the thing I really want to emphasize, and that I've been emphasizing with states and with other stakeholders too, is that it's really important that states design these grants in response to the needs that have been identified and not be making things up. So states have data about who's gotten assistance and who hasn't over the past year from the different pots of funding. They hopefully have data from providers and families on what their needs are. And to be equitable, they really should be trying to think about who has had access and who has not had access to supports, where the biggest impacts of the pandemic have been, which communities, which providers, where is the supply really unstable and at risk, and really try to focus in on that. But they can also think bigger and again, reach more providers. If a state has only been giving support to providers who are part of the subsidy system, this is an opportunity to reach other providers. And then I want to emphasize this part about the state plan. So that sounds really technical, that the state's making their state CCDF plan, which is like their application for federal dollars that they do every 3 years. But in that process, in the law, they're required to do a public hearing. I want to share a resource from Child Care Aware that has information about public hearing processes and state plan processes throughout the country. And you can go there and see what's there for your state. But really this is a really great chance to weigh in about the grants, because they have to put language in their state plan about how they're going to use the grant money. And those state plans are due July 1st. So they're doing this right now, and now is the time to reach out to them. And if anybody needs help reaching out to their state administrators or their state offices, I am happy to help connect people to them. And I'm sure others on the call are as well. So I think I'm going to stop there and just ask if there are any additional questions.
Christine, one follow-up specifically on that, one of the questions that came in is whether or not with the inclusion in your CCDF state plan with reference to how they're going to use the stabilization grants, can those plans for stabilization grants be adjusted after July 1st?
Yeah, that's a good question. State plans can always be changed. They're put in as an application, but most states make changes to their state plans over the course of the 3 years that they're in place. Sometimes they have to file an amendment. It depends on how big a change it is or whether it's actually changing how they're using the money. But it's not really binding. It's what they're asking is just to put their plans for the use of the grants in, and that gives them an indication of how the money is going to be used. So it's after the state plans are submitted, you should continue to be advocating. They're not going to put, the other thing is they're going to put a plan in they're going to put a plan for the grants in their state plan, and it's not going to include every detail of how those grants are going to be designed, administered, what outreach is going to be, how people are going to get connected to them, the TA pieces. So all of those pieces, all those implementation pieces are still going to need a lot of input from the community and from home-based childcare providers and from other providers and from families. So there will be more opportunity.
And one other piece on documentation or finding things in writing, and I know we just really heard about this, right? Friday, late day, about the eligibility paths, but the follow-up question was about, and so I'm sort of curious whether or not CLASP or any of the other national entities are putting those eligibility paths into writing or intend to, because that was the question of whether there was a document we could point folks to for that.
I think the slides we saw Friday had a pretty good description, but they were going to try to get that cleared. And so I think once that's cleared internally, we may be able to distribute that. I have not seen another description in writing of those two paths, and other than in my own scrawl. So I don't know. I hope we can. I would like it to come from them, because I want to make sure we're crystal clear on what it means. So hopefully they're going to get those slides approved, and then we'll be able to share that.
And then we'll make sure through this network of folks that any of those resources get shared with you all as soon as they're hot off the presses.
Yeah. And if there's other questions in the chat that I can answer, I will do that while others are speaking. I don't want to take up any more time. I know I'm already over. So
I know we should transition to Natalie because Natalie's got lots of great thinking too on ways that we can ensure that we're really thinking about family, friend, and neighbor and family childcare settings and using the funds. So let's turn it over right now to Natalie Renew.
Great. Thanks, Gina. Hi, everyone. It's really lovely to be here with you today. I'm going to just dive in so we can go to the next slide. For those of you that don't know, HomeGrown is a collaborative of funders focused on improving access and quality to home-based childcare. And our mission is inclusive of both licensed family childcare as well as the really diverse array of family, friend, and neighbor caregivers that support our communities. And here's a list of our funders. You know, we can go to the next slide, please, Jessica. You know, I think to sort of start this conversation off, you know, we spent much of the last year supporting emergency relief for home-based providers in a number of communities across the country. And by way of context, I think it's fair to say that things weren't great for family childcare and home-based childcare prior to the pandemic, and they certainly got worse as a result of the pandemic. And, you know, for us, there are just some key sort of takeaways and learnings, you know, that we are reflecting on and hope that other states and communities are reflecting on as they think about use of these new federal dollars and how to address, you know, I think what Christine put on the table, which is this issue of equity. So, you know, for us, really an understanding that the supports landscape for home-based providers is diffuse and disconnected, that, you know, there isn't this ongoing durable infrastructure that ensures providers have reliable and timely information, financing and support, resources and professional development in good times and in bad. We saw for sure that for providers, their informal and peer supports were a key source of support, and they relied heavily on them. This issue around sort of the participation of providers in program design, implementation, and governance, for the most part, is just not happening. But that there are also bright spots, that there are programs, organizations, and supports that can be leveraged to really build out more robust infrastructure on behalf of home-based providers. So what I'm going to share is just some recommendations and ideas that we have and a few examples that we've seen over the past, you know, few months to get folks kind of thinking about this. I'm not really going to share these recommendations around the different buckets of funding, you know, as Christine laid them out, but certainly in our discussion, we can sort of talk about what makes sense in which places. So we really have kind of three overarching big recommendations. One is really this opportunity that these federal funds offer to expand inclusion for more providers and families, and to really, in particular, ensure that family, friend, and neighbor providers and the children and families that they serve are included in and supported in our early childhood systems. And, you know, to me, this really gets to the heart, I think, of the question that I think Antoinette asked in the chat, which is this kind of core tension between equally distributing resources and equitably distributing resources. And I think, you know, the former is easier to do, the rationale is much clearer, and the impact is really much lower. And really, this is an opportunity for states and communities to think about what providers and families have been most marginalized, and what are the key data and key needs of communities that are going to be targeted with support. Unfortunately, it's still not enough money to do everything for everyone. And what do states and communities need, both in terms of data and advocacy and support, to target these dollars to communities that have been most marginalized or excluded from resources and support. The other big key, you know, recommendation is really sort of the stabilization, both of the small businesses, but also of the individual providers and caregivers. And then sort of this, you know, once stabilized, looking forward, how do we use this big federal investment to build durable infrastructure and ideally networks that can support home-based providers in good times and in bad? So I'm going to share just a few ideas around each of these recommendations, so we can go to the next slide. So So we saw some really exciting things happening over the past few months. And, you know, I am highlighting two examples here where communities really invested in or expanded their systems to include family, friend, and neighbor providers. In Colorado, the Mile High United Way created a cash assistance program for family, friend, and neighbor providers in 8 counties. In one of those counties, they were joined by a public funder, the county itself, and they were able to provide $2,500 cash awards to family, friend, and neighbor providers so that they could purchase food, stabilize their housing, and pay their utilities. And that is a really exciting program to see as a part of the national landscape. In Oklahoma, the state worked with private philanthropy to create a technology solution to support with CARES dollars, the in-home relative caregiving for essential workers, again, sort of taking the opportunity during the pandemic and with CARES funding to expand their state-funded childcare system to include relative caregivers who had really, left their system for the most part. So there are many other examples, but just really excited to see these places where systems are expanding to include family, friend, and neighbor providers. As a part of our work around creating emergency funds with 13 local communities, we really had some lessons learned that we think can inform states as they develop stabilization funds. And we'll drop a couple links in the chat. But there are a couple of communities that were able to really use their emergency funds as ways to get additional public funding. So that happened in Hawaii, that happened in South Carolina, where the state or the county went to those partners and said, can you help us distribute state funds? And we learned a lot through that process. So I'll share a couple of those learnings, and then Danielle is going to drop kind of a little paper that we had with these recommendations. So one is really to set clear goals and to have like a roadmap. And Christine really talked a lot about this, like what's the purpose of the grant when you're using it for stabilization? Is it a workforce issue? Is it around these kind of basic funds? Is it about making sure that providers have income replacement that they can use flexibly? We heard at the top of the call, like providers really saying like, just give us the money because we know best what we need to do, and how we can stabilize our businesses. So, but setting goals is a really key part of it. We are strongly encouraging states to use trusted intermediaries to get funds out into the community, both because it leverages existing infrastructure, but also we know that there are community-based organizations who have relationships with providers and families that the state may not hold themselves. And this is a really important way to ensure that the providers and families who need these dollars can get them, but also that intermediaries are really well positioned to bring additional resources to the table. Can they get PPE? Can they find other grant dollars? And to bring those together on behalf of providers. Couple more recommendations is just sort of opportunities to engage with local funders and stakeholders in the design. So particularly if funds are being distributed through an intermediary, that really gives other partners an opportunity to engage and to support the distribution of those funds. And also that there's like so much that we still need to learn, and that sort of using stabilization dollars to create relationships with providers and families and to learn about systematic challenges gives us a way to ensure that those big opportunities on the horizon can really be transformational. So we have these recommendations along with some others and really encourage you to check them out. But again, just a lot of opportunity to use these stabilization funds to target them equitably to the communities that need them most and expand the providers who benefit. And then in the last slide, we are really excited at the opportunity to think about what more durable infrastructure for providers might look like and what comprehensive networks that can support providers in improving quality, stabilizing their business, or connecting with other community resources like health and mental health might look like. And so have been working a little bit with Nevada, who's in the process of, thinking about how to use their federal investment to do that, and think that's a really exciting opportunity for many communities to consider. So I'm going to stop there because I know we don't have a ton more time, but happy to dig in the questions, and also we have tons of resources on our website around these ideas.
Natalie, would you want to talk a little bit more about the idea of how, walk through that example of how some of these funds can be used for that durable infrastructure? Because this is definitely something that we get questions about again and again, right? How do I have a staffed network? How do I build a comprehensive network? So helps maybe connecting the dot a little to say these resources can go this way and support you in putting that infrastructure or foundation in place.
Yeah, absolutely. So I think this, the CCDF dollars or the CCDG dollars can be used, both those administrative dollars can be used to support local organizations that are hubs, right? The administrative cost of what it means to be a hub. And so that's an opportunity to ensure that as you look in your community, who are the organizations that are best positioned to have that administrative intermediary role, and to sort of be the air traffic controller of those resources and information on behalf of providers. And so the first place I would be looking at is in terms of some of the administrative dollars and building the capacity of intermediaries and hub organizations to function in that role. I think for sure, we also know that the network itself is a piece of the puzzle, but we have to get a greater and better resources to providers. So, I think increasing, provider reimbursement, reimbursement parity with other settings and things like that are opportunities. And then, using those intermediaries as a place to situate the investments around professional development, technical assistance, access to health resources. So it's both kind of this conceptual consolidation and a place to sort of send those resources, but also a direct investment in those organizations so that they can bring on that staff, have those subcontractors. And I think it has to be balanced with investing in the infrastructure while really prioritizing and investing directly in the providers themselves and ensuring that they are getting the rates and reimbursements that make them whole and sustainable.
Let's take a few minutes just to wrap things up and share some information about the Build conference that's later this summer. So thank you to Natalie as well as to Christine for all of your knowledge and good thinking on this tremendous opportunity that we have in front of us right now. So the next thing that we're going to do is actually a poll. So this poll is sort of continuing to build upon some of how we started in thinking about what your access to giving information on the plans and how much you've been able to be part of accessing the decision makers in your state. So part of this is for us to understand it, but I think it also helps all of us as leaders in this work to really sort of understand how individuals feel about their access to the decision makers and their ability to give input on developing plans to respond to things like the relief funds. It doesn't have to just be the relief funds. It could also even be thinking about your CCDF plans, writ more large than just the relief funds. So I'll give you all a couple seconds. And if by chance polling doesn't work for you within your the platform that you use, Zoom, we share the poll there, obviously on the screen too. So if you want to just share in the chat. And don't hesitate to continue putting questions or resources in the chat. As Danielle mentioned, the PowerPoint and all of the resources will be made available within a few days of the webinar. And then, as I said, as more guidance comes out and we have access to some of the once HRSA, not HRSA, different Office of Child Care. I do a lot on home visiting too. And I was just thinking about HRSA. So Christine can appreciate which department am I thinking about today. Once the Office of Child Care is able to get approval on the slides that they've been sharing about those eligibility paths and really a few other great pieces of information in those slides, then we will make sure we make that available to you too. Antoinette, would you go ahead and ask that question? I'm not sure I understand it. What language should they use to be included? Like the language of the individuals speak?
I think
no.
it's about the essential workers, right, Antoinette?
Right, that's what I'm talking about.
Okay.
She mentioned that they could use it to support essential workers regardless of their income, but whenever they went to apply, they were all getting declined because of their income.
Yeah, it's a state, well, it's a state choice too. Like this is, so they can't, states can use the money that way, but they don't have to use the money that way. And I think, so it's another advocacy point, right? Where it's important for DECAL to know that there are lots of essential workers out there who are maybe just above the eligibility line, but need childcare now. And that's a good use of their supplemental CCDBG dollars. And I'm sure people are telling them that, but it's, you know, that's one of, there's so many decisions that states make, and they need to hear from the community that that's a need.
So if everyone just takes a quick look at the poll results, thanks to everybody for taking a chance to fill it in. Just over 50% feel that you have access to your state plans. And then as far as whether your input is valued and is being used, because we know that asking for input is one thing, then making use of it in the decisions that we make as leaders and stakeholders is a different thing. Folks are sort of neither agree nor disagree, which we could make some assumptions on what that may be telling us. It may be that you're not sure whether or not your input, right? You can't definitively say what happens with your input after you give it, but then 36% do agree that your input is valued and is used in developing plans. So that's great stuff to hear. And then combined with strongly agree, it actually puts us at 43% of folks feel agree or strongly agree that your input is valued and used. And I know that
Jenna,
Sean, oh, sure, go ahead.
I was going to say, you can have access, but if you have access to it in the form of a document with 400 or 500 pages and all different kind of this, that, and the other language, to where it's not meant for you to have a decision. We had an open meeting, but it was 200 and some odd pages. You know, you reading through and it's back and forth. Does this even apply to the home? Is this just to the center? By the time you can't make a statement when you go to the meetings, what can you say? Because there's too much in there.
Right. It's too much. Oh.
Yeah, and I would just say we've heard that from a number of providers in other states that they did not get long enough to review the plans, and that no summary information about the key points of the plans was made available. And, you know, unfortunately, this is going to sound like a bit of a broken record, but I think that is a really important piece of advocacy as well in terms of, you know, how plans are made available, because, you know, the federal government requires that they're shared and that there are these hearings, but the extent to which, you know, that is done in an acceptable way, I think it is really quite different across the different states.
Well, thank you again, Natalie and Christine. I know that there will be more questions, and I know that we'll definitely have more follow-ups, but I know that we're in the last couple of minutes, so I think that we now move to the slide deck has the links to the different resources, but then we also want to close out with a survey for participants. So I'll turn it over to Danielle for that.
Thank you all for your participation today, your wonderful feedback. It really helps us know where to head next in the session. And to that end, we'd like to take a minute to ask you if a quick survey about the topic today and whether it was useful in increasing your knowledge. We'd also like to put in the chat box if there was anything that struck you as new, significant, or interesting during this session. Put that in the chat box. To go ahead and please, you can either private message us, you can send it, share it with the group. You can also let us know where you'd like to go next in these sessions. We've all along been co-creating these national webinars with the audience. And so if there's something that you would like to see us focus on next, we'd love to hear it. And then as we go ahead to the final slide, we want to let you know that we have been on a pattern of every other month hosting the national webinars. And coming up in July is the Build annual conference. And again, this year it will be virtual, but we just had registration is about to open. So here is the link if you are interested in attending, all the information you need there. We will have a suite of home-based childcare sessions as part of the virtual conference, and we look forward to seeing you all there. With that, once again, I would like to thank Natalie and Christine, as well as everyone that spoke up and gave us feedback today, and my partners in this work, Jessica Duggan and Gina Capito. Thank you all so much and have a wonderful afternoon.